For many individuals navigating severe neurodevelopmental conditions, the nervous system often persists in a state of relentless hypervigilance. Traditionally, ADHD has been understood through the monoame hypothesis, a framework focusing on dopamine and norepinephrine deficiencies within the prefrontal cortex. However, addressing these chemical imbalances through top-down cognitive or pharmacological interventions frequently fails to resolve the underlying physical hyperarousal and chronic anxiety. ADHD is better understood as a systemic dysregulation of the autonomic nervous system. Notice the indicators: depressed heart rate variability and a high theta-beta ratio. With a rigid vagal baseline, the body cannot smooth out small stressor spikes, leading to an erratic neurological state. Any clinical intervention that ignores this foundational autonomic state is attempting to build on a compromised physiological baseline. The Preventive Wellness Lifestyle Model, or PWS, offers a path forward through chronic aerobic exercise, rigorous sleep hygiene, and mindfulness practice. These active interventions are designed to strengthen the vagal brake and restore executive function over several months of consistent engagement. We must account for a specific biological threshold. The dotted line represents the maximum autonomic arousal for executive function. A neurotypical baseline rests safely below this, providing the calm state necessary to maintain a routine. In a dysregulated patient, baseline arousal hovers aggressively above this threshold, locked in fight or flight. When stuck above this line, initiating a complex task is neurologically impossible. They cannot access the regulation they're asked to build. This creates a critical clinical bottleneck, a biological barrier that is frequently misidentified as behavioral noncompliance. To solve this, clinicians must use a bottom-up, passive sensory intervention to lower the arousal baseline, opening a temporal window for active healing to begin. Vibroacoustic therapy, or VAT, serves as this passive primer. It requires no cognitive effort or organizational skills from the patient. Because the human body is approximately 60 to 70% water, low-frequency sound waves propagate through tissue 4 times faster than through the air, reaching depths no manual massage can access. Authentic VAT uses single sinusoidal tones, calibrated precisely between 30 and 120 Hz. These frequencies bypass the auditory system, physically resonating with deep tissue mechanoreceptors like the Pacinian corpuscles. This internal resonance provides direct mechanical stimulation to the vagus nerve from within the body. This allows the therapy to reach fluid-rich organs, muscles, and glands that remain shielded from topical interventions. That provides a direct mechanical route to the autonomic nervous system, inducing a parasympathetic shift without requiring the patient's active participation. This therapy is delivered through specialized physical formats: vibration beanbags, pillows, and harmonic plush tools. The design of these tools is intentional, targeting multiple biological pathways simultaneously to maximize the therapeutic effect. First, the low-frequency vibrations actively entrain brainwaves, shifting the neurological signature from high-beta hypervigilance toward calm alpha and theta states. Second, the enveloping shape of a beanbag provides deep pressure stimulation, which decreases sympathetic arousal and lowers cortisol levels. Finally, soft textures activate the skin's C-tactile afferent nerves, which send calming signals directly to the brain's emotional regulation centers. This triggers a neurochemical cascade, including a measurable release of oxytocin and serotonin. These 3 layers work in concert, addressing hyperarousal from neurological, mechanical, and biochemical angles at the same time. This multi-system activation generates a comprehensive physiological shift, clearing the background noise of systemic stress. These mechanisms are integrated into a clinical protocol known as the passive-active feedback loop. In Step 1, the patient undergoes a 30 to 40-minute passive VAT session immediately before attempting a demanding cognitive or physical task. Step 2 represents the result: a temporary neurophysiological window characterized by an increased heart rate variability and a drop in the theta-beta ratio. Step 3 occurs during this window of lowered arousal. The patient can now successfully execute active conditioning, such as mindfulness or organizational training, which feeds back into long-term baseline improvement. By strategically timing the passive primer, the clinician bypasses the initial biological barrier to treatment adherence. The long-term objective is enduring neuroplasticity. Daily VAT priming creates valleys in the arousal baseline, dropping below the executive function threshold. Wellness tasks completed in these valleys provide reinforcement to strengthen the vagal brake. The baseline trendline permanently stabilizes below the threshold. This process is effectively conditioning at the nervous system level, where the body learns to recognize a calm state as its new default. As intrinsic self-regulation and sleep capacity improve, the patient's reliance on the passive primer naturally diminishes. The feedback loop successfully reconfigures the foundational autonomic architecture. Targeting the autonomic nervous system extends efficacy across conditions. For insomnia, vibration-triggered serotonin release initiates melatonin production. For sensory processing challenges, proprioceptive input organizes data without increasing load. In pain management, vibrations jam pain signals via the gate control theory. Whether the goal is reducing sleep latency or managing post-surgical discomfort, the mechanical toolkit remains consistent. These are evidence-based therapeutic instruments designed to simultaneously address the interconnected conditions of stress, anxiety, insomnia, and pain. For practitioners, the priority must shift. Top-down cognitive therapies should be paired with bottom-up, passive sensory modulation. Future clinical trials should move beyond subjective surveys, utilizing objective biomarkers like heart rate variability and EEG to precisely map this synergistic effect. For a dysregulated patient, the potential for neuroplastic growth is unlocked only after we establish the physiological environment where that healing is permitted to begin.